Have you ever collected your ultrasound reports, looked at it, and felt like it was written in another language? You are not alone. Hi, my name is Chinaza. I am a medical sonographer, and on this space, it is everything ultrasound. Today, I am going to be breaking down your pelvic ultrasound scan reports for you, line by line, so you actually understand what your pelvic scan is saying. First thing you see on your report is the uterus. You might see words like anteverted or retroverted. All these simply mean the position of the uterus. Anteverted means it is tilted forward. Retroverted means it is tilted backward. Both are completely normal. It does not mean anything is wrong, and it does not affect your ability to get pregnant. Your report will also include the uterine measurements, something like 7.5 in length, 4.2 centimeter in AP diameter. These numbers are simply describing the size of the uterus, and they are compared to what is normal for your age and whether you have had children. Normal uterine measurements for AP diameter is between 3 to 5 centimeter, and normal uterine length is usually less than 8 centimeter. Next, you may see something like the size of the uterus. If it says the size is normal, that's fine. That means it is between 3 to 5 centimeter in AP diameter and it is less than 8 centimeter in length. If it says it is bulky, it simply means the uterus is slightly enlarged and the values will be higher than the normal range. This can be due to things like fibroids or adenomyosis, pregnancy, but sometimes it might just be a mild variation, so don't panic. Then we also talk about the texture. You might see homogeneous or heterogeneous. Homogeneous means the uterus looks smooth and uniform. This is normal. Heterogeneous means the texture is mixed. This can be seen in conditions like fibroids or adenomyosis. If there is anything like a fibroid or a mass, it is usually clearly stated in your report along with its size and location. And it is important to know that not all fibroids need surgery. Many are simply monitored over time. The next thing you will find on your result is the endometrium, which is the lining of the uterus. Your report will usually include a measurement in centimeters or millimeters. Now, this is very important. This thickness changes depending on your menstrual cycle. After your period, it is usually thin. Before your period, it becomes thicker. So the number you see only makes sense when you consider the timing of your cycle, and that is why the timing matters. Pelvic scan findings can change depending on where you are in your cycle. What I have been calling the uterus is what is popularly known as the womb. Now let us move to the ovaries. Your report will describe the right and the left ovaries separately. If it says normal ovaries, that's good. You might also see something like multiple follicles. These are small eggs and they are completely normal. You may also see something called a dominant follicle. This simply means that your body is preparing to release an egg. It's a normal part of ovulation. Sometimes you may also see something like a cyst. A cyst is simply a fluid-filled sac, and most ovarian cysts are harmless and resolve on their own. If you want more information about a cyst, please check my previous video. I've made a detailed video about what a cyst is and when to be worried about it. The next word that confuses a lot of people is the adnexa. Adnexa simply refers to the area around the uterus and the ovaries. If your report says the adnexa is free, that means everything looks normal in that area. Then we also have the pouch of Douglas, also called POD. This is the space behind the uterus. If your report says no free fluid, that's normal. If it mentions minimal fluid, that can also be normal, especially around ovulation. It becomes a cause for concern when the fluid is significant. Finally, on the pelvic scan report is the urinary bladder. You may see things like well filled with normal wall. This tells you that the urinary bladder looks fine and also helps improve the quality of the scan. It is also important to know that pelvic scan can be done in two ways, through the transabdominal process or transvaginally. The transvaginal scan usually gives more detailed image, but both the transabdominal scan and the transvaginal scan both gives the same information. Now, this part is very important. Your report is not always your final diagnosis. It is part of the medical interpretation that your doctor will combine with your symptoms before making any conclusion. You should make sure to follow up with your doctor if your report mentions things like a large mass, a complex cyst, a thickened endometrium, especially after menopause, or anything described as suspicious or abnormal. So next time you see words like anteverted, uterus, POD, adnexa, you won't panic, you will understand. Understanding your report puts you in control of your health and helps you ask the right question. If you've ever seen any term on your ultrasound report that confused you, drop it in the comment section and I might just make a video about it. In my next video, I'll be explaining your obstetric scan reports so you better understand what each term simply means. If you found this video helpful, don't forget to like, share and subscribe, and I'll see you in my next video.